Good morning, class!
Good morning, Ms. Frizzle!
Today we're embarking on the exciting journey into DNA. What are we going to learn about? A syndrome called Fragile X.
Ms. Frizzle, Fragile X sounds kind of serious.
It is serious, Davin, but learning about it helps us better help the people who are affected by it. Who's ready for an adventure?
We are!
To the bus!
So what is Fragile X? Well, it's a genetic disorder frequently characterized by intellectual disability and other neurodevelopmental disorders. The typical male phenotype includes developmental delay, behavioral problems, and characteristic craniofaces. Females have a similar but more mild phenotype. It's caused by a mutation in the gene FMR1, which encodes Fragile X messenger ribonucleoprotein, FMRP. FMRP plays a range of roles, including in brain development and function, such as binding to ribosomes and regulating the translation of some messenger RNAs in postsynaptic neurons, which is important for normal synapse development and neuroplasticity.
Ms. Frizzle, what can you tell us about Fragile X syndrome?
Well, Fragile X syndrome is the most common inherited cause of intellectual disability and autism. It's caused by a mutation on the FMR1 gene on the X chromosome.
Well, how did it get its name?
Well, in people with Fragile X syndrome, it's caused by a trinucleotide repeat of the CGG triplet. Normally this repeats 15 to 44 times, but in Fragile X it repeats over 200 times, making the X chromosome look fragile under the microscope. Fragile X syndrome is a loss-of-function pathogenic variant in the FMR1 gene located on the X chromosome at locus XQ27.3. This mutation displays an X-linked dominant mode of inheritance. There is an expansion of the normal 5' untranslated region CGG trinucleotide repeat. Normally, this repeat occurs 5 to 44 times in the FMR1 gene. However, in Fragile X, a full mutation has over 200 repeats. The CPG island within the gene promoter and the CGG repeats are typically hypermethylated, resulting in reduced transcription of the FMR1 gene. This can be observed in a karyotype via the distal narrowing of the long arm of the X chromosome. The prevalence of Fragile X is 1 in 5 to 7,000 in males and 1 in 4 to 6,000 in females.
So what do these people experience, Ms. Frizzle?
Excellent question, Oswin. People with Fragile X can have a wide range of symptoms, including intellectual disability, social and behavioral challenges, and some features of autism. They also have several physical features, including a long face, large ears, and flexible joints.
Clinically, individuals with Fragile X may present with developmental delays, learning disabilities, and social or behavioral challenges, including hand flapping, biting, shyness, and hyperactivity. Physical features can include a long face, prominent ears, macroorchidism, and hyperflexible joints. Males are typically more severely affected due to having only one X chromosome. Early signs like speech delays or trouble with motor coordination may appear by toddler age.
So, Ms. Frizzle, how do doctors diagnose Fragile X?
The diagnosis is made through genetic testing. Doctors take a blood test to confirm or analyze the FMR1 gene and to check for CGG repeats. If there are more than 200, then Fragile X is confirmed.
And what happens when someone is diagnosed?
After diagnosis, the focus is on supporting the individual. Various therapies like speech and language therapy, as well as behavioral therapy, and educational support can be done. There's sadly no cure for Fragile X, but in the early intervention, this can make a really big difference.
Wow, Ms. Frizzle.
Thanks, guys.
When testing for Fragile X, start with PCR to evaluate the number of CGG repeats and use Southern blot to assess the FMR1 gene methylation status. If both tests come back negative, consider further testing like whole genome sequencing and FMRP level analysis. Now, it's also important to investigate other potential diagnoses. Metabolic disorders should be on your differential and should be assessed by looking at serum and urine levels of various organic acids. For expectant parents with a family history of Fragile X, prenatal testing can be done by sampling cells within the chorionic villus.
Ms. Frizzle, what can doctors do to support these patients?
Some targeted treatments have been found to be beneficial for patients affected with Fragile X. Those include metformin to help with improving behavior, reducing irritability, and managing weight. CBD has been found to help with the anxiety and sleep issues and some of the behavioral problems. Some clinical trials have shown the use of phosphodiesterase 4D inhibitors to increase cyclic AMP levels and show cognitive improvement. Minocycline is an antibiotic that's been found to have some neuroprotective properties by improving the synaptic structure, which has found improvements in social communication in patients with Fragile X.
Sounds like there's a lot we can do to help.
The goals of non-pharmacological interventions are aimed towards improving quality of life and providing early training and support. Some of the behavioral and educational interventions include applied behavioral analysis, mindfulness meditation and cognitive behavioral therapy, and tailored education programs. Occupational and physical therapies help to develop their fine motor skills and activities of daily living.
While there's no cure, there are treatments to support these patients. Medications can be used to address anxiety, mood swings, and attention deficits.
Some targeted treatments have been found to be beneficial for patients affected with Fragile X. Those include metformin to help with improving behavior, reducing irritability, and managing weight. CBD has been found to help with the anxiety and sleep issues and some of the behavioral problems. Some clinical trials have shown the use of phosphodiesterase 4D inhibitors to increase cyclic AMP levels and show cognitive improvement. Minocycline is an antibiotic that's been found to have some neuroprotective properties by improving the synaptic structure, which has found improvements in social communication in patients with Fragile X.
Understanding Fragile X can help us be more compassionate and supportive. And who knows, maybe we'll find a cure one day.
Gene therapy strategies for conditions like Fragile X syndrome are evolving rapidly. Some promising therapies include antisense oligonucleotide therapy, adeno-associated virus or AAV vector therapy, and CRISPR-Cas9. All of these therapies aim to restore the function of the FMR1 gene and promote the expression of FMRP, which is a protein essential for normal brain function. However, significant challenges do persist. The first of them being is delivering these therapies to the brain, as well as ensuring that they result in sustained expression, and finally, avoiding off-target effects. These are critical obstacles that need to be addressed for these treatments to be successful.
Wow, Miss Frizzle.
That was an incredible trip, Miss Frizzle. I didn't know we had so much to learn about Fragile X syndrome.
I'm glad you learned so much. The more we know about genetics, the more we know about ourselves and others. Let's head back to class.
Just to make your day complete, you might get baked into a pie on the Magic School Bus. Step inside, it's a wild ride. Come on, ride on the Magic School Bus.
Class dismissed. Now remember, the best discoveries are made when we explore with an open mind.
Thanks, Miss Frizzle.